All right. So before I would enter the patient's room, what I would do is I would go ahead and inspect the patient's chart, see what orders we have for today. Then I would go ahead and shut the door to provide the patient with the privacy that they need. Go ahead and perform hand hygiene. Then I can go ahead and introduce myself to my patient. So hi, I'm Miguel. I'm going to be your nurse today. Do you mind telling me your name and date of birth?
My name is Jalen Nguyen, and my date of birth is 8/27/02.
Awesome. Cool. All right, Jen, do you mind if I check your wristband real quick?
Yeah.
Thanks, man. All right, so after using these two identifiers, we now know that we have the right patient, so we can go ahead and proceed with the assessment. So what we're going to be doing today is we're going to be checking your lungs and your thorax, okay? We're going to be listening to your lung sounds, making sure that you're breathing okay. We're going to be checking the rate, the expansion of it, you know. I'll explain it as we go along. Just for some subjective questions though, do you have asthma?
No.
No asthma? Okay. Do you ever run out of breath easily?
Yeah, sure.
Yeah, okay. Do you have sleep apnea? So do you ever wake up and, you're like out of breath?
Yes, sir.
Oh, you do?
Yeah. No.
Okay. Okay. Are you a smoker?
I am a smoker.
You're a smoker. Okay.
Smoker.
Very cool. Not cool, but yeah. So as I was looking at the patient, I don't see any use of accessory muscles. His nostrils aren't flaring. So now what we're going to be doing is, if you don't mind, I'm just going to have you go ahead and take your shirt off.
All right.
All right. Sick. Okay, so right off the bat, the patient's skin is appropriate for ethnicity. There's no discoloration. There's no, I don't notice any pectus carinatum or excavatum. Okay, and I also don't notice any masses or lesions. All right, so what I'm gonna be doing now is I'm just gonna go ahead and percuss. Okay, so what I'm looking for here is I'm gonna be feeling for crepitus, and I'm also gonna be feeling for I'm checking for crepitus and resonance throughout his lung field. His lung field being, from about the second intercostal space to about 6 or 7, where the bottom of the lungs are. Okay, so I'm gonna go ahead and start at the apices, making sure that we're not doing it over any bones. Okay, and we're making sure to do it in a pattern where it's over, down, over, to make sure that it is equal bilaterally. And so far it is. Side. All right, thanks, man. I'm gonna go ahead with this one. Thank you. Okay. So resonance was felt through. I didn't feel any crepitus. I also didn't feel any lesions. No masses. The skin was also warm, dry to the touch. There's no sweating. So now what I'm going to be doing is I'm going to go ahead and auscultate the same places where I just percuss. All right. So every single time I put my stethoscope down, I'm just going to have you breathe in and then breathe out. Okay. Very cool. All right. Just big, deep breaths. Okay. All right. Cool. Awesome. Okay. Good job. Okay. So throughout the auscultation, I didn't hear any adventitious sounds. So I heard no crackles, no wheezing, no rhonchi, which is what we're looking for. We don't want any abnormal sounds. But very healthy lungs. The rate was nice and steady. It wasn't hyperactive. It was a very much appropriate. The depth was within normal limits. Awesome. So now what I'm gonna have you do is I'm just gonna have you go ahead and turn around in the chair. Okay. So there we go. So now what I'm gonna be doing is right off the bat, no discoloration on the skin. I see no bumps, no lesions. Skin is appropriate for ethnicity with pink undertones, same as the front. Before I go ahead and do that, I'm going to check his AP diameter. What we're looking for is a 1-to-2 ratio. So, from here. Perfect. Alright. So, ratio is what we would expect it to be. It's what we're looking for, 1-to-2. Awesome. So first things first, what I'm going to be doing on the posterior side is I'm going to be mapping out the posterior lung field. So we're going to look for C7 right here. And we're going to be going down to the bottom of the scapula. So Jay, if you don't mind doing like a chicken wing, like just like yeah, here, like kind of like rotate this one.
Oh.
Yeah. All right. Oh, you're flexing now, bro? Yeah, just go ahead and do like kind of like rotate this. Okay. There we go. You're good. You can put them down.
Okay.
You're solid. Okay, so C7, bottom of the scapula. This is about T7. What we're going to be doing is we're going to be going down a few spaces. 2, 3. So the lung field is from right here to right there. C7 to T10. Awesome. So that's what we're going to be working with today. So what I'm going to be doing is I'm going to be doing the same thing. I'm going to go ahead and percuss starting at the ABC, same as the front. Awesome. Okay. Making sure we're not hitting on the spine. Perfect. Resonance was felt throughout. I felt no masses, no lesions. Skin is also dry and warm to the touch on the posterior side of the patient. So now what I'm going to go ahead and do is I'm going to go ahead and auscultate. Same place where I just percussed. Alright, so same thing, Jay. Once I put down my stethoscope, I'm just going to have you breathe in, okay?
Gotcha.
Every single time. Alright? Awesome. Go ahead, deep breaths for me. Good. Very good. Okay. Okay. Awesome. All right, good job. So, no adventitious sounds were heard throughout the posterior lung field, same as the anterior. No crackles, rhonchi, wheezing, healthy sounding lungs. Very good depth. I heard nothing during inspiration or aspiration. Alright, so what we're going to be checking for now is I'm going to go ahead and check for tactile firmness, okay? So meaning I'm going to start from here, and every single time I put my hands down, what you're going to say is 99, okay?
Alright.
Alright, so
99, 99, 99, 99, 99, 99, 99, 99, 99.
awesome. Alright, so we're checking that to make sure that the vibrations in the lungs that they do diminish, which they do. So good job on that. So what we're going to be doing now is we're going to be checking the lung expansion, and I'm going to be doing that by going ahead and pinching right here. All right, Jay, so what I'm going to have you do is I'm going to have you breathe in really deep. Perfect. All right, let go. Perfect. All right. So I just checked his lung expansion by pinching, and my thumbs did move apart, but they came back at the same time, meaning that his lungs did expand equal bilaterally. So just to recap, lungs expanded equal bilaterally. Vibrations in the lungs did diminish as I went down, checking for tactile firmness. No lungs, no masses, no lesions. Patient's skin is appropriate for ethnicity, dry, warm to the touch. During percussion, there was resonance throughout both anterior and posterior lung field. During auscultation, I heard no adventitious sounds. There were no crackles, wheezing, rhonchi. Patient had no use of accessory muscles, and his facial expression was appropriate. No nasal flaring of the sort. So all in all, the patient's lungs and thorax assessment, he is healthy and he's good. So